Hello and welcome to Synchronicity Talk Radio for your mind, body, and soul. I'm your host, Marie Benard. Thanks for being with me today. You may be listening to this watching on my YouTube channel, youtube.com/spiritual show, or listening on CITR 101.9 FM in Vancouver, where we broadcast from unceded Musqueam territory on the University of British Columbia campus. Or you might be listening online at CITR.ca, cosmicdimensions.com, empowerradio.com, or on the Co-Creator Network. And wherever you're joining us from at any point in time, thanks for being with us today. And we have a really special guest. I've never had a dentist on the show before, but we are going to be speaking today with Dr. Michael Schecter from Schecter Dental in Toronto, Canada. And the reason that I approached him is I went to the dentist a couple months ago to get a cleaning, and I had a cavity. And the dentist told me that it must be from my diet, but I don't eat sugar. I take really good care of my teeth. And I'm feeling like I've been seeing this dentist for a long time and I get no education from him. I only go in to get a cleaning and then he fills my teeth, does root canals, things like that. And I just don't understand why I'm having all these dental health problems when I take such immaculate care of my mouth. So hopefully Dr. Schecter will be able to answer some questions of mine, and I'm sure that they're questions of yours. He is a biological dentist with who takes a holistic approach, and Schecter Dental is run by Michael and his father Ira in Toronto, and they provide a holistic, preventive, and comprehensive approach to complete dentistry. And this is not dentistry that I've ever come into contact with. So I'm really pleased to have Michael on the show. Thanks for being with us today. Hi, Michael.
Hi, thanks for having me. It's exciting.
Yay. So first of all, I know your father has been in a dental practice for more than 30 years. How long have you been a dentist?
I've been a dentist for 11 years now.
11 years. And what is a biological or holistic dentist, and how is it different from the dentist I've been going to?
Well, I don't know the dentist you've been going to.
Yeah,
but
a regular dentist.
Right. So, I mean, I think it really starts with philosophy. So, whenever I look at a situation, whenever I think about a dental problem, I come back to my foundation, which is trying to minimize invasiveness, minimize toxicity, and focusing on prevention. So, a holistic dentist is a dentist that doesn't just look at the mouth, but looks at the body as a whole, and so recognizes that different materials that we put into the mouth may impact the overall system. Different infections or bacteria, inflammation that's in the mouth might impact the overall system, and the opposite as well. Whatever's going on in the body will also influence the mouth. I think a biological dentist will take that holism and substantiate it by science. So a focus of mine is not just recognizing that the body and the mouth is really one unit, one system, but also making sure that there's sound science, sound published research, preferably behind the work that we do, or the recommendations that we make.
So, Michael, just to clarify, you are a doctor of dentistry, so even though you take a holistic approach and look at the whole body as a system, you're not necessarily giving medical advice other than maybe some nutrition, right?
I'm not giving medical advice. I am a trained homeopath, so I do prescribe some homeopathy in the office, but I'm fortunate to work in a team. And so a lot of the whole body questions, answers approach comes from the two naturopaths, our osteopath, and a nutritionist that I work with. So the idea is to really work as a team. It's funny, I was just talking to someone the other day. Medicine is not so specialized. There's so much to know. And in a way, it would be nice to kind of go to one person that can take care of everything. I think in reality, it doesn't work like that anymore. And so we need to work as a team so that we can offer that holistic, comprehensive approach to patients.
Okay. So when someone comes to see you, there's something on your website, which I will post the link. If you're watching on YouTube, I'll post the link below. It's schecterdental.com. But one of the first things you do is a Canary scan. Is that right?
Right. So I think that we again, going back to that whole concept of like biological dentistry, I like to establish baselines with my patients. So I like to say, this is where we're starting, and then we can track and see this is where we're getting to. So I really use 3 tools with most patients to establish those baselines. One of them is a Canary scan. The Canary system was developed by a dentist in Toronto. It's laser technology that assesses the extent of demineralization. So basically, we take this little wand and we go around each surface of each tooth and get a baseline reading for the amount of cavity or the amount of demineralization that's there, and we can then track those teeth. So you went to your dentist and you had a small cavity that needs to be filled. So you might say, you know what, I don't want to necessarily drill and fill that tooth. I want to try to work on remineralization. So this is my baseline Canary number. Let's go nuts. Let's try to remineralize the tooth, and maybe we'll come back and check it with the Canary in 6 months or in a year and see how that's changed.
And okay, so I've been to the dentist where they've done an x-ray and they've said, okay, it looks like you're starting to get a cavity, but we'll see if it heals itself, which I'm assuming is remineralization. But then that was it. It was just like, okay, we'll see what happens. I didn't really have any advice. How does one remineralize a tooth?
Right, so that's the golden question. If I knew the perfect answer to that, I might not be working as a dentist anymore. No, but it's many different things, right? So just to step back for a second, I was saying there's a few tools that I use as baseline. So something else that I use is a pH test. In my opinion, the acid-alkaline balance in the mouth is such a critical factor in terms of how decay develops and how to prevent or arrest decay or cavities. Your enamel dissolves at a pH of 5.5. Your saliva buffers the acidity of food and helps to prevent decay. So if your saliva is more alkaline, or if you're reducing the acidic attacks in your mouth, then you'll develop less cavities. So a few guidelines that I try to follow: take the week's worth of sugar and put it into 1 shot. If you're not having that sugar ongoing throughout the week, then the bacteria in your mouth isn't eating that sugar and converting it into acid, which is impacting the teeth. It's better to have a shot of espresso than to sip on a coffee throughout the morning. That sort of idea.
I think that's where my last cavity came from, because I'll have like 2 big mugs of coffee and it takes me like an hour or more to drink it.
Right, the same idea with like a lot of people do lemon water in the morning. So have like a shot of lemon instead of drinking it. Or if you're having a smoothie, which is really acidic and it really like coats the teeth, maybe rinse with baking soda or salt water right afterwards to neutralize the acidity in your mouth, and then brush 30 minutes later. When you have something really acidic, it will actually dissolve the outer layer of enamel. And then when you brush your teeth right away after, you're actually wearing away that hard layer of enamel. So it's better to do your acidic attack, buffer that acidity, and then brush after.
So just to clarify, an acidic attack is anything acid that you're putting in your mouth, like pop, Coke,
right, but even
sugar.
Food is acidic. Even like a freshly made smoothie in your house is arguably an acidic product that's going into your mouth. Anything that's carbohydrate based, so even whole grains, legumes, the bacteria in the mouth is still going to eat that or consume that and produce acid. So most food intakes, most beverage intakes ends up being an acidic attack in the mouth.
And so if you're like me and I work mostly from home, which means I take about 20 different trips to the kitchen a day, I probably should just have 1 meal instead of snacks.
So nutrition is an interesting thing, right? I mean, you can speak to 15 different nutritionists and look at all these different universities and research centers, and it will give you different information. I think right now some predominant facts that are coming out is there's been a shift. This might be a little complicated, but there's been a shift from our typical metabolism towards a different type of metabolism. So if you can go back to grade 10 chemistry for a second, or grade 10 biology, we learned about glycolysis, or how the body produces energy through with using glucose to metabolize glucose. And there's a different type of metabolism we can push our body into, which is called ketosis. And instead of burning carbohydrates or sugars, we're burning fat. And by doing that, you're much less prone to cavities because your body is not using those sugars anymore. To do that, you're supposed to fast for 12 hours a day. There's many other factors involved, and a big part of it is fasting for 12 hours so that you're not continuing to feed your system with sugar. So to my knowledge, to my understanding, the latest research on nutrition talks about not necessarily snacking throughout the day, but trying to kind of have like a few solid meals and then having a long period of fasting.
Interesting. I know anyone familiar with like low carbohydrate or Atkins diets. I know I eat low carbohydrate, which I don't eat sugar. That's why I was so surprised that my dentist actually showed me on the camera as he was filling it, where it was all white inside my tooth, and he said that was like demineralization, which he said could only be from my diet. So. Yeah,
I mean, it's a hard, I mean, listen, I have patients that come in that have, the most impeccable, perfect diet, and they still develop decay. I mean, we don't have all of the answers. These are just guidelines that can help people. Personally, my diet, I'm vegan. So arguably a vegan diet is horrible for teeth. I'm fortunate, maybe it's genetics, maybe it's my oral hygiene, maybe it's, the environment that I grew up in where I wasn't, my parents have good teeth, so there wasn't a lot of the microbes in their mouths that can then be passed into my mouth. But I have good dental health. I don't have any restorations or any fillings in my mouth. But I think right now the model would be what you're describing is that low carb, high fat diet. The Weston Price Foundation is a nutritional foundation that focuses on dental health, and they talk a lot about fermented cod liver oil, the quality parts of animal products. So it's not so much the boneless chicken breast, but it's more the marrow from the bones, beef broth, organ meats, where you get a lot of the dense nutrients. My focus as a vegan, as an eater, is to be a nutritarian. I really like that concept, to have high nutrient content food. I don't like to waste calories. There's a great scale that was developed by a doctor, Joel Furman, and he basically ranks food from what's the most nutrients dense down to what's the least dense. So kale is my favorite vegetable. Has a rating of 1,000. It's perfect. And as you go down, most grains are in the 600s. And what's amazing or shocking to me is that white bread is 30. Fine, accept that. But whole wheat bread is only 35. There aren't a lot of nutrients per calorie in bread. And so when I look at eating, I think a part of it is, are we consuming a lot of empty calories, and how is that impacting our digestive system? How is that depleting our mineral reservoir, which is our bone and our teeth, and then impacting our dental health?
Wonderful. And you had mentioned earlier how you look at the whole body, and one of the things that is really impacted by our dental health is our heart, right? Heart disease comes from people with a lot of cavities tend to have a higher risk of heart disease.
Yeah, so I think you're referring more to gum disease, how gum disease
maybe that's it.
Is an inflammatory disease. So to my understanding, inflammation is linked in our body. So inflammation is the body's response to a problem. If you get a splinter in your finger, then you'll get a little bit of redness around the splinter. And that redness is the body's response. It's saying, hold on, there's something there we don't like. We're going to send our inflammatory cells or our white blood cells to the area to try to erode the splinter. If you leave that chronically, the white blood cells will not just erode the splinter, but will start to erode the surrounding part of your finger. And that's what gum disease is. Gum disease is long-term chronic buildup of plaque or calculus or biofilm or microbiome, and the body responding by sending white blood cells there. So this inflammation, these white blood cells will sit there and erode the bone. And that's where you get periodontal disease or gum disease or bone loss. Other inflammatory diseases are, autoimmune diseases, heart disease, diabetes, osteoporosis, any of stress, lack of sleep, any of these things will trigger an immune response or an inflammatory response, and that inflammation travels throughout the body. It travels in our circulatory system. So if we're developing inflammation in our mouth, it's a risk factor for other inflammatory disease. If someone has inflammation from a herniated disc or diabetes or stress or poor diet, any of these things, it will also travel and show up in the gums and elsewhere. Going back for a second, we talked about the Canary, we talked about the pH test. The other thing that I really like to do is a plaque analysis. So we take a sample of a patient's plaque and look at it under the microscope. We can see levels of inflammation. So if a woman is pregnant, often their gums will be inflamed. If someone has diabetes, their gum will be inflamed. So the conversation I always have is, I don't know where this inflammation is coming from. Let's clean your teeth, let's get the mouth healthy, reevaluate the gums. Is there something systemic or whole body that is contributing to this inflammation? And that's where I kind of tie that into our naturopaths and try to get them to seek care. Or is it merely local? And usually it's a combination of the two, and we work to try to maintain it. I think one thing that's really critical to understand here is that if you have inflammation under the gums, even if you're doing an amazing job brushing and cleaning your teeth, but you still have inflammation there, you're still prone to gum disease. So it's not your fault that you have a cavity. It's not your fault that you have inflammation under the gums. It's often a combination of many different aspects that you have to target.
Thank you. And you also mentioned, I want to ask you a bit about the naturopaths and the other practitioners that you work with. But you mentioned how your wonderful healthy teeth come possibly from genetics, and you said something about your parents maybe not having the same microbes.
Right.
So if I go and kiss someone with bad microbes, am I going to get bad microbes? Like, how does that work?
You got to practice safe kissing. I'll tell you a story. I had this young grandmother. She's probably in her late 50s, really fit, really healthy, motivated, and she came in and we did one of these plaque analysis, these slides. And she had candida, which is a fungus or a yeast in her gums. And so she freaked out because she's, very healthy. And she was, committed to doing everything she needed to do to get her candida under control. And candida is something that we shouldn't normally see under the gums. So the classic way to deal with candida is to go on a candida diet, which basically means starving candida. Candida eats sugar. So by completely eliminating sugar, you'll arguably reduce the candida in your body to a level where your immune system can then manage it. She did that. We did a follow-up slide, and the candida was clear. 6 months later, the candida came back, and we were confused as to why. After some time, we were able to understand that she has a 4-year-old grandson that has asthma. Taking a puffer predisposes you to candidiasis, or an overgrowth of candida. And when she would hang out with him and kiss him, it would eventually overwhelm her immune system and the candida would come back. So I think she ended up going on like an antimicrobial regimen specific to candida that she took ongoing to protect herself, because obviously she wanted to maintain a strong relationship with her grandson. And I think she ended up putting him on a candida program, which helped a lot. So I know I'm going a little around the question, but the answer is yes. The microbes in your mouth are contagious, like all microbes are. If someone has a lot of cavity-causing bacteria in their mouth, they will pass that on to somebody else. The same way you can pick up a parasite or a fungal infection from anywhere. I mean, if it's in someone's mouth, it could be passed along.
But I would imagine that the stronger your own immune system is, the more protection you have against any of that.
100%. An analogy I often give is, if you're in the room with someone who has the flu and they're on the other side of the room from you, your immune system can be great, it can be weak, you're probably not going to get it. If they're breathing down your face, it doesn't matter how strong your immune system is, you're probably going to get the flu. If they're somewhere in the middle of the room, then it depends on how great your immune system is. So a lot of these things have to do with yes, your immune system, but also the quantity that you're exposed to, the quality of the microbes that you're exposed to, and realistically, all of our immune systems fluctuate. I have three lovely little children, and when they wake me up at 2 o'clock, 4 o'clock, and 6 o'clock in the morning, my system just doesn't function as well as it does when I get 6 hours of sleep. So
I hear you. All right. Well, I wanted to know actually, what is ozone treatment?
I love ozone. So ozone is ozone. It's O3. It's what we find in the atmosphere. I think the best way to explain it is ozone is nature's response to a problem. So on the ground level, from a global perspective, the planet produces ozone to combat pollution or smog. I don't know what goes on in Vancouver, but in California, if you open the newspaper, there's always a smog reading or an ozone reading. And basically, ozone is produced in direct proportion to smog. So they know how to measure smog based on the amount of ozone that's in the air. So the nature is producing ozone to combat smog. In our own bodies, our neutrophils, our white blood cells, produce ozone to combat disease. So when you see those little cartoons or you hear those stories about how, we get sick and then our white blood cells go to the bacteria and engulfs the bacteria and kills the bacteria, what is it actually doing? It's secreting ozone to combat the bacteria. So the use of ozone is an amplification of our own natural response to disease. It's impossible to be allergic to ozone. It's impossible to have a reaction to ozone. It's simply oxygen. So it's a wonderful modality to use. It's safe for pregnant women. It's safe for children. It's safe for geriatrics. It's safe with medications. It's fantastic. It's 5,000 times stronger than chlorine in terms of how effective it is. It gets pulled like a magnet towards the source of the problem because of its strong negative charge. And it can penetrate everywhere because it's a gas. So I believe that ozone has numerous applications in all of medicine. I can give you a few examples. At Mount Sinai Hospital in Toronto, they're using ozone now to disinfect the rooms where patients with antibiotic-resistant bacteria are. So I'm waiting for them to actually treat the patients with ozone, but for now we're doing the room. So we'll get to the patients, but that's one example. I can tell you in impoverished areas of the world, I know they're doing this in Gaza, for example, where it's almost impossible to get medication. It's very difficult to get proper medical care. They've developed ozone machines because ozone is really cheap. It's just an electrical current, and they're generating ozone to help deal with infections and create cleanliness.
Pardon me. Sorry. Sorry about that.
No problem. I hope I turned my phone. I'm going to turn my phone off now.
It's actually, the ringer is off, but it's a reminder. I've set these reminders to be like happy and positive and stuff, and I didn't realize it was set for the middle of our interview. My apologies.
That's great. So ozone. So in dentistry, ozone has numerous applications. You can use it to disinfect a tooth before you fill a tooth with a filling. You can use it to disinfect before you put a crown on. You can use it to disinfect root canals before you fill a root canal. There's a whole root canal controversy out there, and depending on your leaning and philosophy, some patients don't want root canals, some do. But ozone can help to disinfect the dentin and the canals in a root canal. Something that we do with regularity are ozone trays in the mouth. So if someone has inflammation under the gums, gum disease, we make them a custom tray for them, and it just seals along the gum line so we can fumigate the arch with ozone. So we'll get in underneath the gums, it will lubricate the gums, it will help to protect fillings and keep crowns and fillings lasting longer. It's really fantastic. And three other ways I just want to mention for ozone. One is in necrotic bone. So sometimes if somebody has an infection in the bone, a previous extracted site that hasn't healed, then you can do ozone injections, ozone fumigation, or direct ozone into the area to encourage that bone to heal. Often bone doesn't heal because there isn't adequate blood flow to the area. So ozone will hyperfuse the area with blood. We also have an ozone sauna in the office. It's actually from a company out west, from Nanaimo. longevity ozone. They're a great company, good Canadian company. And so yeah, you can kick back. It's 102 degrees steam sauna with ozone. So it helps to penetrate into the tissue. It encourages lactic acid production. A lot of patients come if they have like a skin infection, if they have muscle issues, if they just want a sauna for detox. And often they'll sit on a towel in the sauna, and the towel will actually be black afterwards from all of the toxins that come out of their body.
Wow.
Yeah.
I gotta check that place out in Nanaimo. Maybe there's probably some naturopathic clinics around here that have a sauna like that.
Maybe, yeah, you check out longevity.
Cool. And so you also have a whole product line on your website, which is schecterdental.com. And again, if you're watching this on YouTube, I will put the link below in the video description. But I think, isn't there some kind of like powder, there's some kind of ozone product that you sell too?
Yeah, so we, probably about 8 years ago now, I realized that a lot of the products that I wanted to offer my patients didn't exist. And that's kind of where the journey started. So right now we have 3 products, and we're working on a 4th, which is really exciting. So I started with a post-surgical rinse, and I do a lot of surgery. So we do a lot of extractions, which is why I was mentioning the ozone with the bone healing, and a lot of gum surgery, implant placement. And we need a mouth rinse afterwards to encourage healing and help to prevent microbial growth. The standard stuff on the market is disgusting. It burns your taste buds, it stains your teeth, and it's an antiseptic. So it kills the healthy microbiome in your mouth. We spend our whole lives trying to build up that microbiome. That's why antibiotics are so destructive. We want to maintain that optimal type of flora or optimal type of bacteria in our bodies. If you get rid of it, that's where you allow things like candida to come in. So instead of using something that just kills, the mouth rinse that we have supports. So there's CoQ10 in there, there's aloe in there, there's echinacea in there, and then there's also some natural antimicrobials like golden seal and tea tree. And it's a soothing product that helps with healing. So that's kind of where I started. It's a great product. People love it, and it really works. And then we started to venture off. So we have an ozonated olive oil. So it's extra virgin organic olive oil infused with ozone. It's pure olive oil ozone, period. So I use that to brush my teeth. That's what I brush my kids' teeth with. It has some remineralizing capacity to it. It's antimicrobial, anti-inflammatory. It's excellent for the gums. So ozone oil can be used, I mean, we use it post-surgically in sockets. It can be used with any gum inflammation. It can be used for tooth sensitivity. I have a really good friend of mine that has a lot of acne on her face, and she's tried many different things, and her doctor at the end just prescribed her an antibiotic to take ongoing daily. They said, just try just ozone oil on your face every day. And it's obviously not addressing the root cause of the acne. It's, some sort of inflammatory issue in her body that's allowing for these eruptions. But topically, it works, and it helps to keep things clean. And the third product that we have is something that we call a cavity guard. It just isn't available. Iodine has been published and proven to reduce the rate of decay by up to 50%. But that means that it helps to reduce the rate of cavities by up to 50%. All you have to do is paint it on the teeth once every 2 months. So we have Health Canada approval now with our product to paint it on once a week, and you can dip your floss in it and floss once a day. So it's all organic, carnauba wax, beeswax, olive oil, thyme, and peppermint flavoring with just 10% of iodine. It doesn't stain your teeth, and it comes in like a little nail polish bottle. You just kind of paint it on, and that's it. So if someone is developing decay, or if you have like little small incipient decay between your teeth, you can just kind of floss with it every day. It's an excellent preventative tool. And the exciting news, I might be jumping the gun a little bit since we're still in the development stage, but I've been working on a natural bleach product. And that doesn't exist right now. And I probably get every single day somebody coming into my office saying, I want to bleach my teeth, what do you think? And my stock answer is, it's not going to do anything for your health. From an aesthetic perspective, kind of depends on how they look, but I usually will advise them that they have a beautiful smile, and it's something that would really have to come from them. I do very little bleaching in the office. But I recognize that there's a void out there, and a lot of patients want to bleach their teeth. They feel motivated, maybe because of their profession or where they're at in life. And there needs to be an alternative. I mean, the petroleum and the chemicals that are in the synthetic bleach products are disgusting, to be frank. And you're ingesting anything in your mouth, you're ingesting. So we are in the testing stage. We have a product. My wife was my first tester, and her teeth are white. So soon to be announced.
Awesome. I wanted to ask you, okay, so if people are interested in checking out those products, schecterdental.com, and there's a link to your store?
Yeah, you can go to schecterdental.com, or you can also go to shecs.ca, SHECS.ca.
Okay, I will also put that down in the description below if you're watching on youtube.com/spiritual show. And yeah, I noticed though that the products are in US dollars. Is that right?
I don't know.
Oh, okay. I was looking at it earlier and I was like, oh, the dollar is so bad right now. I don't want to order it.
That's interesting. I genuinely don't know. Loretta, my wife, like helps me manage some of that stuff. It might have just been the way it went up a few years ago. I will look at that.
Okay. Normally it wouldn't be that much of a problem, but the way the dollar's been lately.
No, you're right. When we started doing this, when we started that website, it was probably on par. It wasn't really a question, and things have changed significantly. So there are some. I mean, we try to buy as much as we can local, but there are some products that we get from the States, and the pricing is crazy. It's like gone up 30%.
I'm just gonna wait till that siren passes.
Sorry, there's another one.
It's okay.
There we go.
We'll just wait. Okay, sounds like it's gone now. So I wanted to ask you that's interesting about iodine. There's so many things. I saw a TED Talk on Netflix the other day about years and years ago, I think it was in like the 50s or something, they did a study on children who were dying of cancer, and they discovered that it was because women were getting x-rayed during pregnancy. And even though this was like proven to be an issue, they were still x-raying women who were pregnant for another 20 years after. So even though science is showing these things, it takes so long for the medical establishment to take a lot of it on. Why do you think that is?
It can be frustrating. You know, I don't have an answer for you. You know, I think people approach health and approach life in different ways. My personal philosophy is to try to be progressive. I'm always looking for an edge to be healthier, to be better, to move forward. I think another approach could be to be very methodical and careful and make sure that all of the evidence is there before moving forward. I definitely would say that, you know, my protocols and my approach is research-based, but, you know, I don't move at the glacier pace that, you know, the universities and colleges move at, right? So, and they maybe have a different level of responsibility than I do. But it's frustrating. I mean, listen, there's controversies in dentistry that I don't know if it's fair to call them controversial anymore. The Mercury controversy in Canada, we don't recognize mercury as a toxic or unhealthy material in the mouth. Health Canada, the Royal College of Dentists, say that it is safe to place amalgam fillings. As a dentist in Canada, I can't tell you there's anything wrong with mercury fillings. If you look outside of Canada, I think there's substantial research, substantial conversation about the potential harm of mercury fillings. And whether it's right or whether it's wrong, what troubles me, kind of what you're saying, is why aren't we having a dialogue about it? What's the harm? What's the risk of having this conversation? Maybe we're wrong, and maybe mercury is completely safe. It doesn't seem like that to me, but why aren't we having the dialogue? To explain that a little further, I mean, basically, I don't know if you're interested, but there's organic mercury and inorganic mercury. So the elemental mercury, what you get in the fillings, what you would take out of the ground, is mercury in its pure form. That apparently or supposedly has no harmful effect. It becomes harmful when it gets combined with carbon into an organic form. So the reason that fish is much more harmful is because fish converts elemental mercury into this organic mercury. So that when we eat fish, we get that mercury from the fish. I have seen paper after paper that demonstrates that our body converts elemental mercury into organic mercury the same way fish does, the same way every organic matter does, because we're made up of those organic molecules. We're made up of the carbon. So we're allowing that product to go into our body, and we don't even have a conversation about it. We're not allowed to have a conversation.
Are you allowed to share your opinion on fluoride?
Yeah, so I will share my opinion on fluoride.
Okay.
You know, it's another controversy in dentistry. Fluoride has been shown to reduce the rate of cavities. Basically, fluoride will interface into the enamel structure, into the structure of tooth, and make it harder, less prone to decay. Let's accept that as fact. It might arguably be controversial, but even if we accept that as fact, the question is, well, what else is fluoride doing? So fluoride displaces iodine in our body. Iodine is a critical hormonal regulator. It's critical to regulate against radiation and electromagnetic frequency, which is so important in today's day and age with all of the electricity and wireless and everything that's going on around us. It's been proven to be a neurotoxin. It's been proven to increase the rate of osteosarcoma or cancer in boys under the age of 12. So, in my opinion, I would rather have more cavities, or I would rather take a different approach to maintaining my teeth, or I'd rather even take out a tooth than have those type of long-term effects on my body. So in my house, in my office, we have a water filter that filters out fluoride, 100% of the fluoride, but it filters out a significant percentage of the fluoride. And we minimize fluoride use in the office. So if a patient asks for fluoride, we will offer it to them, but otherwise we don't use it.
And then what you brush your teeth with is that oil with the ozone in it. So you don't even, it doesn't sound like you use the regular toothpaste that you get at the drugstore.
Right, so I do my best to avoid pharmaceuticals and chemicals in general. I don't think any one specific product is necessarily going to cause me harm, but it's the accumulation of those products over time. In addition, to be honest, is supporting those companies and those products, because the only vote I have is with my dollar. And if I don't make choices with how I'm spending my money, then I really, I don't have any other great way individually to enact change. And so if I want better, healthier products that have reduced toxicity, I have to support those products. So yes, I use primarily for toothpaste, I'll use ozone oil. I'll use Dental Herb Company, which is a good company in the States. And I'll use sometimes Theodent.
Theodent?
Theodent. So Theodent they're an interesting story. They were researchers at a university that realized that theobromine, which is this enzyme from chocolate, helps to grow enamel. So it actually is a remineralizing toothpaste. It's the only natural remineralizing toothpaste that I've seen or that I know of. And the kids' brand actually tastes like chocolate. So it's a great product. Very fancy packaging. I think they won the packaging award a couple of years ago. Yeah, it's a good product.
Cool, good to know. Okay, well, we have just a few minutes left in the show. We have been speaking with Dr. Michael Schecter, and he is from Schecter Dental. You can find them online at schecterdental.com. He is a dentist, a biological dentist, a holistic dentist in Toronto, Ontario, Canada. You can go to schecterdental.com, and if you want to check out the dental products and preventive care that he has, you can go to shecs.ca. That's SHECS.ca, and I will post the links below. If you're watching on YouTube, it'll be in the video description. So, Michael, where would you like to focus for the last few minutes of the show?
So I think a few things, and I definitely want to, in a positive light, because we always tend to focus on, in general, I think the negative, right? We've been talking a lot about these controversies in dentistry, and we're talking about the toxicity in dentistry. You know, I think there's a lot of interesting and amazing things coming out of dentistry right now. I just read this incredible book. I'm just in the middle of finishing it, and it's by a Japanese researcher called Teeth Are Organs. And it's completely flipped me around in terms of how I'm looking at teeth. I'm still processing the book, but he basically jumped onto this old age study a few years, or probably a few decades ago at this point. And there was a study in Japan where they were taking a look at lively elderly people. Why are some elderly people lively, energetic, well, and some aren't? And they were looking at different factors. And so he said, well, you can't do this study without also taking a look at the health of their mouth, what's going on with their teeth. And he didn't expect to find that much. But basically he started to take a look, well, when they're well, how many teeth do they have versus when they're not well, how many teeth do they have? And out of this research, he accumulated this incredible data where he shows that teeth have such a strong influence on so many different parts of our health. He shows that they almost generate a frequency or a sound when they're in use. Wow. And that frequency or sound can influence blood pressure, balance, digestive health. He listed a few others, and it's not just in passing. Like he did significant research on these different topics. And basically, if someone was, I'd have to pull up the book to really see, but if you're missing, you know, a tooth over here, then that might lead you to having lower blood pressure. If you're missing a tooth over here, it might lead to increased blood pressure. Basically, what he's showing is that the rhythm, the frequency of the teeth help to balance these different systems in our body. It's really cool. And he has this clinic in Japan where by balancing the occlusion or providing that more ideal bite so that the teeth are meeting in balance, together with removing toxic materials from the mouth and some other things, trying to keep the mouth healthy, he's helping people get well. And, you know, listen, I mean, I'm in this profession to help people. I want people to be well. I want their mouths to be healthy. And I think that I've taken it a step further where I'm not just looking at the health of their mouth and the function in their mouth, but also looking at their overall system. And that's why we work as a team. I don't have the tools myself, and, you know, I rely on Dr. Schulten and Dr. Siegel, the two naturopaths here, and Bryce, our osteopath, to really tie everything together. This guy's taken it to a whole other level. And he's put into this book different specific or individual stories of patients that had debilitating degenerative diseases, whether they were in wheelchairs or you know, were scheduled for open heart surgery to try to deal with major cardiovascular issues, and just through improving and changing their dental health was able to get complete resolution. Not partial resolution, complete resolution.
Wow, that's amazing. Who would, and wow, I mean, I never would have guessed that.
Me neither. I'm like, wow, I actually work on a part of the body that is absolutely critical. So, you know, I look forward to learning more about that. I definitely have it on my bucket list to go visit his clinic in Japan. I haven't told Lorraine that, so when she listens to this, she'll be like, are you crazy? We have to be little kids. We're not going anywhere. But soon to be, I would love to see that. So that's a really amazing thing. I think another aspect of dentistry is the imminent regenerative possibilities. So right now, with the Canary system and with the remineralization that we're doing, we're just at the beginning, just barely at the tip of the glacier. And I think, I'm hoping in 10 years and 15 years, you're going to be able to walk into my office with a cavity, and I can say, oh, no problem. Let's just grab a little stem cell from here and a little this from this, and slap it on, and boom, you'll have a new tooth. And it will be from your own natural product. We're doing this really neat service here. We're doing platelet rich fibrin. We're doing a blood draw, centrifuging the blood. All the red blood cells drop to the bottom. All the fibrin come up to the top. And we're taking that fibrin, all those healing factors with some stem cells, and that's what we're packing into extraction sites. That's when we're encouraging healing, minimizing infection, minimizing pain, and it's a 100% from your own body. Nothing is added. I'm optimistic that that type of technology is going to advance into regeneration.
And can you repeat what the name of that was? Because you broke up a little bit.
Sorry, it's PRF, or Platelet Rich Fibrin. So it's become quite popular with athletes, where you'll hear about PRP, or platelet rich plasma. Kobe Bryant went to Germany a few years ago and had that done on his knee and came back and had an MVP season. So PRF is similar, except you actually get, instead of it just being a liquid, you get a tangible product. It's like a little piece of schnock. And you can pack that into discs, so we can put that into extraction sites, or you can actually flatten it into a membrane. So a lot of the grafting procedures, a lot of the surgery that we do, we need membranes to cover those areas. Instead of taking a membrane off the shelf, we can now use your own product from your blood to make a membrane.
Wow, cool. So I actually wanted to ask you about where things are going with stem cells and the lasers and all that, because I have a tooth over here. I didn't want to get a root canal. My dentist was telling me, oh, you'll probably need a root canal. And I was like, no, I'll never get a root canal. And then it got to the point where I was begging for a root canal because it was so painful. And so I'm wondering about, because eventually that tooth, there's only so long that that's going to last, right?
Right.
So it sounds like you're saying at one point in the future, I may be able to get that extracted and grow a new tooth. Or would you be putting in one that was grown in the lab?
Right, so I don't know exactly what's going to happen. I try to stay current. There's nothing that's talked about at the dental shows. There's nothing that's around the corner or on the horizon. But there's, I know the University of Alberta is working on tooth regeneration. There were some articles coming out of England where they're working on it. In China, they did something weird where they use a combination of like kidney cells from rats with stem cell, like your own stem cells and urine or something like that to grow teeth. Yeah, so there's things that are happening. Is it going to be 10 years, 15 years, 20 years? I don't know, but I really think that's the next frontier of dentistry. So right now, a solution would be, to a tooth would be either a denture, a bridge, or an implant. They all have their pros and cons. I'm optimistic that in the future we'll have this tooth regeneration, and hopefully there won't be any consequences or negatives to it.
And I'm wondering, in most places in the world, I would say there's not, like in Canada, we're so blessed to have health care, but we don't really have dental care unless you have a really great plan where you work. So where do you see economically the future of dentistry going?
That's a good question. It's really hard. I think in general, in society, we're seeing a great divide where there's the growing or the shrinking percentage of the population that has the means to really access what they want, and a growing percentage of the population that is not drawing enough income to support their daily sustenance. And it's a real issue, and I see it in dentistry just the way we see it everywhere. Costs are going up, and income is either staying the same or it's going down. So, the more extravagant, the more elegant procedures in dentistry are really expensive, and even just the regular procedures in dentistry are very expensive, and it's difficult for someone without coverage at a low income or middle income to afford dentistry. It's a real issue, and I don't really have great answers for it. I do my best to be accessible. I do my best to accommodate my patients. A lot of people will come in and say, "Oh my God, your fees are so." I charge Ontario fee guide. I don't mark anything up, so I charge the same as every other dentist in the city, and I'm very reasonable with my patients. But in general, there's a connotation when people say, "Oh, the dentist charges so much." If you think about it, 3 people are working on you at the same time. There's someone at reception and an assistant and me, and so it's a lot of manpower to be working on one person. So I don't know where it's going to go. Maybe things will get more mechanized. I don't know. Hopefully with some advances in technology, things can get cheaper. If regeneration comes from a laser or a light and it's just time, maybe a technician will be doing it instead of a dentist. Who knows? But time will tell.
All right. Well, it has been wonderful speaking with you. We are and have been speaking with Dr. Michael Schecter, and he is from Schecter Dental, which is run with his father, Ira, as well as a whole team of dentists, naturopaths, nutritionists, it sounds like you said, a whole team of people who are going to help you with your body, your mouth, your health in general. And you can find them at schecterdental.com. If you're not anywhere near Toronto, but you want to check out their products, you can go to shecs.ca. That's SHECS.ca. And Dr. Schecter, is there anything that you want to add or emphasize before we say goodbye?
Brush your teeth every day. No, I want to thank you so much for your time. I mean, I think you're doing a great job, highlighting health issues for everybody and making sure that we all learn and become aware of our bodies and the world around us. So thank you. And I think from a dental perspective, I think it's important to remember and recognize that dental health, like our overall health, is not just about one thing. You can't eat what you want all day, remain sedentary, take too many stimulants, stay up all night, have your face glued to your phone and think just because you brush your teeth and floss twice a day, your teeth are going to be healthy. And I think that's the same thing for everything we do in life, and myself included. We have to make sure we remain balanced and remain rooted and grounded to nature.
Wonderful. Well, thank you again. It's been such a pleasure speaking with you. And I got to stop drinking coffee for the first 2 hours of my morning, I think. Yeah, my vice. Okay. Well, all right. This has been Synchronicity Talk Radio for your mind, body, and soul. If you're watching this on YouTube and you found it helpful, please subscribe to this channel, like this video, and share it with someone, because dental health affects your overall health, and you know that your overall health affects the way that you show up in the world. So if you want a better body and a better world, we've got to take care of our overall health. So please do share this with someone that you love. Thanks so much. I want to send you lots of love. Be well. Namaste.